Parents are both pharmacists.
Okay.
They both got their pharmacy degree here in the States, and they had always been taught that this was an African American disease only. And so they've never heard about sickle cell disease in the Indian community.
Welcome to Sickle Cell Sundays. Today we have a special guest, Dr. Amie Patel. Thank you for joining us. She obtained her medical degree from the Western University of the Pacific, the College of Osteopathic Medicine, and she chose internal medicine as her pediatric residency to focus on the transition care for sickle cell patients. In 2022, she completed her Meds Peds residency at Loma Linda University. She did a combined fellowship in sickle cell disease at St. Jude's Research Hospital. And then she went on to start her current job at UCLA as a sickle cell specialist and the associate director of the sickle cell program. An amazing background. I guess let's start this off with what inspired your interest in sickle cell. There's so many specialties out there. So why this one?
Yes, my sister had sickle cell. It was 3 years older than me, and so I had known sickle cell disease my entire life. She unfortunately did pass away back in 2010. She had a bone marrow transplant, and then after 2 years of suffering from graft versus host disease, she passed. But it was her idea to do, for her Girl Scout Gold Award, to have really bring awareness to sickle cell disease. So started the first sickle cell annual awareness fair, started having sickle cell support groups, and then after she passed, our family decided to continue her legacy, start a nonprofit, and continue to do support groups and do awareness fairs after that. And so I had worked with a lot of individuals with sickle cell disease, found a lot of the barriers really specifically in that transition age, and I saw how much she had suffered, and as she was getting older, more and more pain crises and pain episodes, and so I kind of wanted to do something in the field.
Oh wow, that's beautiful, and sorry for your loss. Can you talk about your first visual experience with sickle cell? What was that like?
So the first that I remember was when I was around 5 or 6 years of age, and she had suffered from a really severe acute chest syndrome. So she was in the pediatric ICU for over a month and a half. And she was intubated, and she had a very, very severe episode, and no one knew if she was going to make it or not. And that's kind of my very first memory of her being sick with sickle cell disease. And then after that, she, continued to have pain episodes. At that point, thankfully, no more as severe acute chest syndrome, but she continued to just be sick since then.
Was your family knowledgeable about the disease prior to them having her?
Not at all. So my parents are both pharmacists.
Okay.
They both got their pharmacy degree here in the States, and they had always been taught that this was an African American disease only. And so they've never heard about sickle cell disease in the Indian community.
Wow.
So when they got in the newborn screen, which she was born in California, and just that year they added sickle cell disease to the newborn screen.
Okay.
And so they had gotten a letter saying that she had sickle cell disease, and my parents were in complete disbelief. Wow. They were like, but she's Indian. How does she have sickle cell disease? And then they slowly learned about it, and we learned about all of the, in general, how wide sickle cell disease affects globally, and how there's over millions of individuals in India suffering from sickle cell disease.
Wow. I know you said that, like I said earlier, you said your sister's older than you. Do you know if you carry the sickle cell trait at all?
I do. I have sickle cell trait.
Okay. And then they test you when you were younger, because you said they started the screen testing after her?
The newborn screening, yes. Okay. But I actually knew my parents did an amniocentesis to see if I had sickle cell disease trait or when I was in utero.
Right. Okay.
Surprisingly, my newborn screening did not come back in the mail saying I had sickle cell trait.
Oh, wow.
But I did get retested, and I do have sickle cell trait now.
Okay, I'm glad you
Yes.
got retested because that's important to know, especially in dating and
Yes.
family planning. Would you say that your relationship with your sister was impacted at all with you being healthy and her having sickle cell?
Yes, and no. I mean, it's always hard, right? She's your older sibling who you look up to. At the same time, too, you see her in pain and crises, and someone that always constantly has to be taken care of because, you know, of how bad her disease was. And so it was an interesting dynamic. While I was the younger sister, she always had to be taken care of more by the parents. And so that dynamic was always different growing up. And the one distinct memory that I have was that she was very, very ambitious.
Okay.
She worked very hard. She ended up getting into pharmacy school, actually, while she was having her transplant. But she, I remember, like, in 4th grade, I was like, wow, she had to work so hard in 4th grade. This must be, like, the hardest year. I'd get there, and it wasn't that bad.
Yeah.
And then same thing, 6th grade, 7th grade, 8th grade. And so it just kind of showed how hard she worked, but just to keep up with her peers. But she did.
She didn't let her health stop her.
She didn't let her health stop her.
That's beautiful.
Yeah.
I want to switch over to your experience as a professional. Sometimes I see doctors who have no idea what sickle cell disease is. Do you feel like doctors are taught enough in their process in medical school and residency on what sickle cell patients experience?
I would say no. So in medical school, there's a lot to learn, and it's unfortunately, it's not necessarily focused on. And then even in residency, it depends on where you train.
Right.
So if you're in an area with high amounts of sickle cell exposure, then you may be more comfortable with it.
Okay.
But it's not necessarily emphasized in the curriculum in general in terms of training. And so if you don't have much exposure, then you wouldn't have as much experience.
Okay.
And in addition, right, sickle cell disease is a very underfunded disease, and so research in it, guidelines, has not quite been as robust as other diseases. While we are catching up, and there is a lot more research being done in sickle cell disease, a lot more progress, but still most of the guidelines that are written are very low evidence certainty because there just hasn't been as much of a wealth of research in the past.
Wow. Do you feel like if there was a difference in the amount of materials or education on sickle cell while doctors are coming up, it would make a difference?
I definitely think so. And it's not that people aren't interested or wanting to learn. It's more that they just don't have the exposure.
Okay.
And so what I've seen is that, you know, even where I work now or when I talk to other community physicians, that they do have a lot of questions and they want to learn and they really want to do what's right for the patient. They just never had that experience and that exposure.
Okay. On the other hand, doctors that are reluctant to learn, is there any common pushback that you face as a professional with your colleagues? Like maybe you have a recommendation and they don't have experience with sickle cell and then they are now giving you pushback. Are there things like that that you may face in your current role or previous roles?
There is some degree of pushback. I think the biggest thing though is like once you get more established, at least the place that you work, that pushback gets to be less and less.
Okay.
Once they're like, oh, actually, you know, I've seen that this really has helped prior patients or this has really, you know, changed the course.
Right.
And then they're like, okay, yeah, maybe there is something to be learned in this situation. It is definitely different though if, you know, a patient is at a different community ER, then they're like, who is this person who's calling and saying what I should and shouldn't do?
Right.
And then definitely met with a lot more reluctance.
Okay. That makes a lot of sense. As someone who doesn't have sickle cell, how would you describe sickle cell disease or the trait to someone who's unfamiliar with it?
Sickle cell disease, it's a blood disorder, and it is a genetic disorder. You're born with it. You have a mutation in something called hemoglobin. And hemoglobin's in all red blood cells that are in your body. And what happens is that it causes the sickle shape. and it can cause blockages in your vessels, and that can result in extreme pain. I always like to tell everyone it's a blood disorder. Blood goes everywhere in the body, so it affects every single organ and system. So yes, there's an excruciating amount of pain that can happen in episodes, but it's also just slow organ dysfunction and death, as you're not getting oxygen that you need to different parts of the tissues, and you're living with that for the rest of your life.
Very good explanation. I know sometimes when I'm describing it, I say blood is like the engine in your car, and if that's not functioning properly, everything else starts to break down.
That's a perfect metaphor, yeah.
Yeah. I don't know when I figured that out, but I'm not a big car person, but at some point in life, I was like, this is the easiest way to explain it to people who don't understand. As minorities, I know sometimes we face pushback with Western medicine, and I know Western medicine is very vital for sickle cell patients. What are your thoughts on holistic medicine?
I think everything in conjunction. While there is a huge utility to Western medicine, and we've seen since the 70s to now with more invention of medication, pediatric patients are surviving into adulthood with the invention of penicillin, pneumococcal vaccination, taking very seriously fevers in pediatric years. We've really increased survival with Western medicine, but I also think that we really need to focus on the whole body as well and the whole person, because that takes the majority of someone's health, focusing on lifestyle, nutrition, any supplements. For pain relief, I do think that, doing acupuncture, visual imagery, or other things in beyond to just your normal, take hydroxyurea, penicillin, is also really good to support the whole person.
Right. And you just mentioned 2 long-term medications for sickle cell disease. Are there any treatments or medications, curative options that you feel you're passionate about or that you've seen really work for the sickle cell community that you would often recommend to patients?
It's a very large question. So in December of 2023, there were 2 FDA-approved gene therapies for sickle cell disease. I never say the word curative because we don't know. Right. It's definitely very transformative, and I've seen it transform individuals' lives where they had significantly less to no pain episodes, and and as we study it more long term, in terms of we have 6 years worth of data, we could figure out, is it truly curative? Is this going to stay in your genes forever? Those edited genes, are you not going to have any sickle cell disease complications afterwards? But it is a very, very transformative therapy for individuals who do have more severe sickle cell disease complications.
Okay. With you experience your sister passing away from graft versus host disease, how do you feel about gene therapy using one's own genes and kind of decreasing the risk of that?
So I think gene therapy is a great option because you really do decrease the risk of graft versus host disease, as you mentioned. So my sister had a bone marrow transplant where you're using a donor to transplant. And so you're getting rid of her bone marrow and then you're putting a donor. Unfortunately, I was not a match. So even being a full sibling, you have to have certain HLA matching. And so at that time, she had an unrelated donor match, which increases your risk of graft versus host disease even further. With gene therapy, you do get rid of that risk for graft versus host disease. And while we don't know fully if this is a curative option, I do think moving forward with more research, even just trying to perfect the best type of gene therapy, we'll definitely reach the point where we might be able to say it's curative.
Yeah, that makes a lot of sense. I know with gene therapy, there's still an aspect of chemo, and I know in order to change anything with your cells that's needed to wipe out what exists, do you think there will ever be a transformative or curative option that will not have chemotherapy involved for sickle cell patients?
I think potentially, or even a less aggressive chemotherapy regimen. Is something that's always being explored. I'm hoping in the future, that we could at least have something that's a little bit less aggressive of chemo, and that will perfect more of the type of gene therapy. There's many, many different types, lots of people doing research in it. The two that are FDA approved have two separate targets in terms of molecular targets.
Yeah.
And so I'm hoping that, the more that they continue to explore and understand gene therapy, and we test out more different types of gene therapies, we can find what works best with the least amount of complications,
right,
and the least amount of medications that are needed to achieve a successful gene therapy.
In a perfect world, these treatment options would already exist, but in order to get there, we need people to participate in clinical trials. And I know within the sickle cell community, there's a lot of mistrust when it comes to medicine and new treatments. What advice would you give to people who are interested in it but are fearful of participating in the clinical trials that do come out that will make a difference for either them or patients beyond them as far as treatment options?
I think the biggest thing to realize, right, with clinical trials, that while it may not directly impact your life, I mean, some do, right? If you're in a clinical trial for gene therapy, that could be very transformative for you.
Right.
If you're in a clinical trial to test a different disease-modifying agent, it can affect your life. But the biggest thing, right, is that you want to contribute to the wealth of research and advancing the disease in terms of developing more and more treatments. So if that feels right for you, then, then go for it. If there's any degree of hesitance and you asked all of your questions and you understand the risks, the benefits of doing it, then take a pause. Right. Make sure that you're ready.
Yeah.
Because you don't want to do anything and feel forced into going into a clinical trial. That's the last thing that you should want to do. You should make sure that you're well informed, you understand what that clinical trial end goal is, believe in it, and then at that point move forward.
Okay. What would you say would be 3 questions that someone should absolutely ask if they were considering a clinical trial?
So first one is, what's involved in terms of your participation?
Right.
And so, is it a medication that you need to be taking for months, or is it something as extensive as, a gene therapy where you're going to need chemotherapy and it will be as more transformative? And then 2, are there any known side effects and what are my potential risks? And then 3, what type of phase is this? Is this a phase 1, 2, 3 study? Right. If it's a phase 1 study, then I always like to say that you're really doing this to contribute to the research.
Okay.
If it's a phase 2, 3, it's gone out of the phase 1 stage, you're in later stages of clinical trials, and we're really trying to perfect dosing and also safety of the medication as well.
Right.
So those are the main questions.
Yeah. Thank you for sharing that. I know a lot of people don't know enough about clinical trials or the different phases. So thank you for also breaking that down so that people are aware of what stage it may be in and what exists in that stage. That's very helpful. Let's talk about the future of sickle cell. What do you think patients can do to make things better for our community or others being educated about the disease?
I think doing exactly what you're doing, which is, broadcasting it, bringing awareness to it, talking about it, discussing it with other individuals. That's what continues to spread awareness, continues to spread information. And I think in sickle cell disease in general, it's really hard to find the right information.
Right.
And so continuing to spread just education to other warriors is really, really important. And to other individuals who aren't warriors, who just want to learn more about the disease.
Right. That's a great response. Thank you. One thing that I know you've worked on a lot is transition care. And as someone with sickle cell, I have first-hand experience of how going from peds to adults is an intense shift. What advice from a medical professional standpoint would you give to the pediatric patients that are fearful or looking to know what they're going to experience in adult care? How can they prepare themselves to receive the best care that they can from the different doctors and teams that they need?
So I would say the biggest difference in pediatric to adult is, one, I would say the hand holding isn't quite there.
Yeah.
And so as you're getting closer to being 12 years of age, really starting to advocate for yourself and knowing what medications you're taking, why you're taking them, understanding more about your disease, so that on the adult world, if you do encounter someone who may not have as much of an understanding, you could really explain, what your disease is, why you're taking the medications you're taking, and, explain to them what you do need.
Right.
So I think that's one of the biggest things, is just really start to learn your disease. As you get closer to that transition age, just recognizing some of the key differences.
Yeah.
So, your parents may not be there to call and, order your medications. Learning how to talk to a pharmacy, learning how to schedule your subspecialty appointments, understanding the differences between adult and pediatric ER. So unfortunately, you're competing with now all of the adults who are sick for ER space.
Right.
Wait times, unfortunately, around the country are extremely, extremely long. Mm-hmm. And while, we are doing better education to really triage individuals with a sickle cell vaso-occlusive episode at a level 2, even still, wait times can be very, very long.
Right.
And, unfortunately, with just how overcrowded and short-staffed ERs can be across the country. And so really just understanding that, knowing what you need to do before, in terms of knowing that you might have a 10 to 12 hour wait. So what can you do to prepare prior? So just really trying to put yourself in the best state before you transition, and then having someone with you in the emergency room.
Yeah.
Because that's the biggest shocker from pediatric to adult.
Very true.
I would say is that the emergency room experience.
Yeah. With the ERs, I know it's going to be a while before things change, because there's just so many people in this world and so many people seeking help. What would you say is the best way someone can be prepared to go to a new ER that may not be familiar with them as a sickle cell patient? What can they bring with them, or what things can they do to make sure they get the best possible care from an ER that may not know them?
So if you're established with a sickle cell provider, and I always encourage every single sickle cell individual, have an outpatient provider that understands sickle cell disease, and maybe if they don't understand it, at least that they're compassionate and are willing to learn and explore and provide the best care for you. Mm-hmm. But try to come up with a individualized pain plan.
Okay.
And so if you're not in an area that has a huge ER where everything's integrated and you do have to come to community ER, have it be provided in a letter form where you can see it in your MyChart or your whatever patient portal messaging system that you have, a letter from your doctor saying what's your typical ER pain regimen and what's your different inpatient pain regimen. Mm-hmm. And if there is a way to contact that doctor who wrote it, to also include that in the letter.
Yeah.
I think that's really valuable to have when you are going to the ER, to really advocate, being like, hey, this is written from my sickle cell provider as a recommendation.
Yeah.
2 is bringing someone with you, because when you're in a lot of pain, sometimes words can escape you.
Yeah.
And so being able to advocate for yourself the way that you normally do when you're not in excruciating pain is going to be different.
Definitely.
And so if you can, having someone with you will be very helpful. Mm-hmm. Making sure that you are bringing all of the things that you need to stay warm and hydrated.
Okay.
Because unfortunately, most of our ERs in Los Angeles area here, especially, are all intense in the parking lot.
Yeah.
And so making sure that you're bringing the staff to stay warm, hydrated, is the main thing, and anticipate a wait. Mm-hmm. So if you need to bring any of your home medications, bring that with you, and keep that with your the person who came with you.
Got it. Yeah. I agree. It makes a difference when you have that or you have a person with you in the experience you get. If you could change one thing in the world of sickle cell, what would it be?
I would definitely say just higher knowledge, awareness about sickle cell disease. I have seen a lot of individuals where, they go into the hospital and we're missing some sickle cell disease complications that could potentially have been caught earlier.
Yeah.
And so I think that just more education, and even on the warrior side as well, making sure that we're educating what are signs that are concerning that you need to go into the ER is definitely something that's lacking, and I really wish can change in the world of sickle cell disease.
Yeah.
And just having more providers who exist in the world, because I know it's really, really challenged to get access to a sickle cell doctor at times.
Right. I support that answer. Is there anything that we haven't discussed that you would like to share before we close?
I'd really want to say, especially for the warriors, it's really important to have that group that can advocate for you, that can, you could talk to, confide in, who understands sickle cell disease. Whether that be, a family member, a friend, someone in the community, it's really important to have that support because going through this alone is very, very challenging, and, it's hard to go through. And I always like to really, emphasize the importance of holistic medicine, and your mind is really, really a part of how you feel as well.
Yeah.
So it's really important that you're talking about it, that you're sharing, you're advocating, and it might not be something that you're comfortable with sharing right away, but over time, it could really, really help and change your whole mindset.
I agree from experience. Thank you so much for all that you've shared today and just being here. It makes a difference, and I know you're doing so much and you'll continue to do so much for people like myself. This concludes the 3rd episode of Sickle Cell Sundays. Thank you for tuning in. Please like, comment, and subscribe.